for observations. So those can also be included in your lab study. Okay. The fourth one is about health hazards associated with healthcare in the hospital and in the community. What are the health hazards in the hospital?
Hepatitis B infection,
Okay.
hepatitis C infection,
Hmm.
then also
HIV.
HIV,
Hmm.
urine infection,
Yes. In the community.
respiratory tract infection.
Okay. In the community, it is a little different in the community, isn't it? In the hospital, you get even needle stick injuries, health
Yeah,
hazards,
yeah.
isn't it? Whereas in the community, what can you think of? Any communicable disease?
Measles, measles, dengue, spread of
No,
dengue.
those which are associated with healthcare waste.
Achha.
Those which are associated with healthcare waste. For example, you can do those who are in the picking up the healthcare waste in the community. That is the rag pickers, the needle stick injuries among them. Okay, and they are handling the infected waste also. Sometimes if it is thrown, as I told you yesterday, in the home based care, if it is thrown along with the solid waste, what happens? Okay, we can look into that also.
They are also infected with hepatitis B, hepatitis C,
Yes, yes.
as well as HIV because
Oh, okay, so in the community, if you're doing it in the community, you should be a specified area. It should be one specific area. So after you do the study, what are you expected to do? For example, you have heard that there's a person who's had a needle stick injury. What next? You have to, it is not enough if you do the study and leave it at that. No, you will have to help the people there. So you will have to
yeah.
get some hospital nearby.
bring to ART center.
Huh?
ART center में उनको लाएंगे.
Yeah, yeah. You have to collaborate with the primary health center or the district hospital or the
Yeah.
uh, community health center and see that these people get the necessary treatment. So we are, it's along with the doing the study, we'll have to also help them in the process, right? Next is survey of incinerators. How many of you all have actually visited a CTF, CBWTF, Common Biomedical Waste Treatment Facility?
मैंने भेजे.
Huh?
I have seen the common biomedical waste treatment plan.
Yes, I can't hear you. Yes, please repeat.
मैंने देखा है मैडम CBW जो था.
आपने देखा है तो उसका सर्वे कर सकते हैं क्या?
नहीं वो भुवनेश्वर में है हमारे एरिया से बहुत दूर है.
दूर
नहीं
है,
कर सकते. हाँ.
नहीं कर सकते. अगर आपके अस्पताल लोग आपको परमिशन देकर आपको एक व्हीकल भेजते तो जाकर देख सकते हैं ना.
Yes,
परमिशन
yes,
चाहिए,
yes.
परमिशन भी चाहिए लेकिन
During, yeah, during training, we went to that place sign जो
just to see
CBW
how
place.
the process takes place, isn't it?
Yeah, yeah.
But you have not seen how the, what are the this one, the pollution control board gives them certain checklists, no? So you have to take the checklist with you and survey that incinerators.
Okay.
That is also a possibility. It can be done, isn't it? Your hospital will have the CBWTF attached to them, no?
Yeah.
So they will help you to get permission, right?
Okay.
And what the pollution control board asks for the reports, you can go through these reports. You can have the checklist with you, go through these reports, okay, find out whether the reports are timely, whether it is accessible. All those you can do in your survey of incinerator. So that itself can be another project. Okay. Then I also told you study health hazards on waste, because this was already completed in the topic 4, right? So it could be waste because it could be the general population also, the people living in that particular area. Okay. So here it is specific. In the sixth topic, it is more specific. We are actually limiting them to the waste pickers, right? See, a KAP study can also be done, knowledge, attitude, and practice. Okay. You can do that on their knowledge about healthcare waste, how they are, what is their attitude, what is their practices. It could be done in the operation theater, surgical wards, ICUs. Okay. These are the important areas where we get the waste generated is more, isn't it? So once you have done the KP study, what next? You will have to have some training program for them. So maybe after 6 weeks or so, after 6 weeks minimum, we say. So after 6 weeks or maybe after 3 months, you can again go back and see how is their practices, whether it has changed, okay, after your education, okay. So you can compare their knowledge, attitude, and practice before and after giving the health education. Is it possible?
Yes, ma'am.
Yes,
You
ma'am.
can do it. It need not be in all the 3 areas. It can be in one area only. You can do it. Okay. So even if you have a sample size of around 30, that's more than sufficient. You have nursing staff in the operation theater who are always on shift duties, isn't it? So in the operation theater, you may be able to get around 30 staff nurses on various shifts.
Ma'am.
It is possible. Otherwise, you can take all these 3 areas together, and a sample size of minimum of 30 is what is usually any study for that matter. Usually, minimum sample size required is 30. So you can either pool them together or individually. If you get 30, you can do in one of the areas. Okay. And this is a little thing, doing a study on 3 R's principle, that is reduce, reuse, and recycle. What is the practices being done in your hospital on these 3 R's? You can do a study. The person, the purchase department, you can go to the purchase department. Okay. For some, in some of the places for recycling, they give it to a registered recycler, this plastic waste and all that. So how much, what is the revenue generated? Can also work on those lines. Okay. Are you clear on this? Eighth topic.
Yes, ma'am.
Okay. Ninth topic is conduct a study on radioactive waste generation and the health hazards. Okay, so radioactive waste generation means you have to go to the radiology department. Okay, conduct a study on how much of radioactive waste is generated. Okay, it can be done for the, it can be done retrospective, how much is the waste generated, and prospective, you can do what is the health hazards of the people who are working in these, in the these departments. Okay. And this is very commonly done, survey of needle, and this is a part of your hospital infection control committee meetings, survey of needle sticks injuries. So you will have this report with you. Okay, where it was done, when it was, when did it happen, what is the reason. All these can be done as a study. Okay, survey of needle stick injuries. The next is, if you are using mercury in your healthcare facility, you can do the study. That is, what is the effect of mercury? How many spills have occurred? What are the? It may be a very small study. Okay, it may not be sufficient enough for your report. Okay, patient safety and healthcare management. Patient safety is the new this one. No, now topic of today is on patient safety. In most of the hospitals. So you'll have plenty of material for patient safety, isn't it? Especially staff nurses who are here for this program. Am I right?
Yes, ma'am.
It's a new buzzword that is being used now. Okay. For example, if there's any healthcare waste management conference, along with that, they put this as a patient safety also as a part of the conference. Okay, so there are plenty of topics in this patient safety where you can work on. Study rural immunization programs in your district and methods. See, for example, in the district, you have various PHCs which come under your district, sub-centers which come under your district. So all those maybe you can go to each one of them or do a sampling of them, of the district, okay, and study the rural immunization program. What is the waste that is collected and how it is disposed. In fact, I had done this study when I did my certificate course in healthcare waste management, where I looked into the uh, volume of waste, the weight of those various waste that have been collected. Okay, so this is another one. So here you can do a sampling of of the your district, which areas you want to go based on convenience. Also, you can go and collect the data. Study. This is one more thing. Regulatory mechanisms. This can be more like a review study. You take all the uh, literature from various states and do a review of it and put it across. Okay, so this is more of just sitting desktop writing. It can be okay. It is not that you're doing something actively. And the next is study of different waste treatment systems. This you need to go into all the waste systems. That means you are going to look whether there's an autoclave, hydroclave in your hospital. Usually hydroclave is not available. It is available only in few places throughout the country. So you can look into all these. Okay. Study the health hazards of hospital waste to waste handlers within the hospital. You can think of that. Okay, here the sample size may be less. So you can think of at least 3 to 4 hospitals and find out what is the health hazards of these, whether annual health checkup is done for these people, whether the records are maintained. So this is what you can see by studying various hospitals. Okay, here you need at least 3 to 4 hospitals to get that requisite sample size. Okay. Impact of different training and awareness programs on healthcare waste management. You can conduct training programs in your own hospital, okay, based on the various cadres of healthcare workers. Okay, so you can club them together and do a training program. So you can have a pre-test and a post-test. You do a pre-test to find out their knowledge, then you give them the training, and then this is followed by a post-test. So this can also be a project. Study of centralized facilities in your region. This is centralized facilities, meaning the common biomedical treatment facility. Okay. So how will you do your project? It could be a case study. A particular hospital, you could do a qualitative research, speak to the administrators and find out. For example, a reduce, reuse, and recycle, those 3 R's principle, you can do a case study. KAP studies also, you'll know how to do it. Assessment or evaluation studies, this can be done for the CTFs. Okay, assessment and evaluation, having a checklist, right? You could also have comparative study, compare the healthcare waste system in one hospital with that of but the size of the hospital should almost be similar. You can't compare a small hospital to a large hospital. They should be comparable in all ways. Okay, I mean by the number of departments that they have, the number of beds that they have, it should be almost equal so that you can compare them. Okay. What is case study? It is an in-depth study of a particular event or a circumstance or a situation. This type, as I told you, can be waste disposal or management of a particular hospital. Another could be management and recycling of segregated waste collected within the community. So this is a case study. In a case study, we have to go into depth about the procedures adopted by that particular hospital. Okay. You may have to observe certain places, you have to have a checklist, certain places you'll have to have a one-to-one interview with the person or the official concerned. Here the time, as you'll have a time limit, isn't it? Your project should be finished within 3 months, is it? Then how many months you should complete your project? Yes, answer me. Within how many months?
One month.
Is it 1 month? Only 1 month you'll have. Then you should decide fast. You should write your project protocol, okay, and work fast. KP studies is for topics like segregation of waste, for reporting needle stick injuries, for hazardous waste management, and it can also be used for those 3 R's: evaluation of training and capacity building programs. Also, you can have KP studies. For KP studies, minimum sample size should be 20. It could be a semi-structured questionnaire or an interview method. Okay? If it is a KP study, they should be about 7 to 12 questions each for knowledge, attitude, and practice. Okay, this you should remember very well. KP study, 20 people and 7 to 12 questions. Okay, so if you are deciding for a KP study, please see that this is your criteria met. Assessment or evaluation studies, the procedures involved in management of healthcare waste management. You need to find out what are the steps followed by that institute. Okay, and in that you may have to interview a few people. It could be open-ended, where you keep the questions, and as and when they answer that, you can write it down, or it can be closed-ended. That means it is an answer is yes or no. Okay, and after collecting all this information, find out what is the standard methodology of such a procedure. We could have comparative studies also. Comparative studies to find out whether similar procedures or studies are adopted by different institutions. That means, but since your time limit is only 1 month, I think it's a little difficult to move around from one place to another. First of all, to get the permission within your hospital, it is okay, but with other hospitals, to get permission may be difficult unless your head of the institution is able to help you out. Okay. You could study the hospital waste management of 2 hospitals or waste disposal methods of 2 healthcare facilities. And you have to be able to critically evaluate both of them. You know, what is the difference in both these hospitals? Okay. And if you are describing any one system, what is the advantage of that system as compared to the other? What is the disadvantage? You will have to write that in your results. Okay. What is the place of the for doing the project? It is better that you do it the project in your own place. It is feasible. The area and the resources should be available for you. For example, if you need to collect more data, you may require help from your friends, someone else who is able to do it for you along with you. Okay, the methodology also you'll have to think, so that within 1 month you should be able to finish the project. So planning and conducting the project, you have to decide. As you already said, it is 1 month. So in that 1 month, maybe about 3 or 4 days, you may need to sit and write your proposal, your project proposal. After that, another 2 weeks to collect the data, and then another week for report writing, analysis and report writing. So this is how you have to, this is called as Gantt chart. So here you're going to write each week how much of time you're going to spend. Okay, so that once you have decided how to do it, then you are able to finish it within that time frame. Otherwise, it will be difficult for you to finish within the time frame. And depending on what type of study you're going to do, the size of the sample can be determined. Okay. Methodology, how you're going to do it, that should be described in detail in your project report. Okay. Additional resources like equipment, tools, your manpower, that also you'll have to assess whether you'll be able to finish it or not. You'll have to think of the time limit that is there, and based on the time limit, how many, if you're just giving a questionnaire, how long will it take for them to finish the questionnaire? Can you give the questionnaire and go back and collect it from them, is what you have to decide. Or whether you only have to administer, as they answer your questions, you have to sit and write the answers. So in that case, you need to be spend more time with the person. So you'll have to divide the time in such a way that you're able to collect all the performance. Okay. So time frame is what is very, very important. Next is writing the project report. You will have to give a title to your project. What are the objectives? The objectives should be SMART. That means it should be specific, measurable, attainable or achievable, okay, realistic, time bound. Okay. So these are how you should frame your objectives. Okay. So you should be able to do it within 1 month. Okay. Then in your project, you're going to write your topic, your objectives, the introduction to the project. Okay, you will have to do some review of the literature. So when you do the review of literature, you will get something to write in your introduction. So your introduction should give you the statement of the problem. For example, needle stick injuries. If you're taking that as a topic of the project, you'll have to write the objectives. Introduction will have all about needle stick injuries. How much is the prevalence worldwide? How much is the prevalence in India? How much is this in your state? You have to write all that, okay, in your introduction. And why you're doing, ultimately you have to write why you are doing that study. There's very less literature in your own state, so that's why I took up the study, or something like that you'll have to write. So finally, that will give you the reason why you took up this project. Then next you'll have to write the methodology. Methodology will be what is the study design, what is the sample size, okay, what is your inclusion criteria, what is your exclusion, what are the, who are the people, or who are the things you're going to include, who are the ones who you're going to exclude. Okay, how you will do it, you will have to write it down. Okay, so the methodology is also an important part of your report writing. Then you write your results, that is the observation and discussion. So your results will be the observations, discussion will be based on your result. Okay, the discussion will be based on your result. Then finally you will conclude or summarize and then give the recommendation. You may also add on the limitations of your study. I could not do this study because of this particular, I could not, my sample size was 20, but because of time constraints, I could not complete 20. I had to do with only 18, or out of 20 people whom we had chosen, only 18 were available during this entire 1 month. The two people who were supposed to be part of the project, they quit the job, something like that. So you'll have to write even that also. It could be a limitation of your study also. Okay. So this is what was suggested, because you all are in certain states where you are working in hospitals, healthcare facilities. Okay. You can evaluate the segregation practices in your district. Okay. So you'll have to put this way, introduction to this. Okay. Objectives of your study. So the main objectives of the study are to identify and assess the disposal practices of biomedical waste management practices in different healthcare facilities in the district with the respect to the biomedical waste management rules 2016. So can some of you all do it in your district?
So I would like you to respond to this, that who will, for whom it will be easy for you to do. So, and any problems that you will face, you can please discuss with madam.
Yeah, please tell me, where are the challenges or the
Good
problems?
afternoon, ma'am.
Good afternoon.
This is Dr. Panikre from RC Bhubaneswar.
Yes,
Yes,
yes.
sir.
Good afternoon, sir.
Good afternoon.
So, any of the students, please, anybody would like to ask any clarification how to go about the project? Nobody has any questions?
No, they're wondering whether it is possible to do or not. That's why they're just
The
thinking.
member has left the meeting.
No, but they should ask. Yes, yes.
Ma'am,
Trusha, you want to say something? Yes.
yeah, out of ma'am, very good evening, ma'am. Out of all those projects given, we can do any one, na?
EH board, but Jacob
No,
has
the
left the
one
meeting.
which I'm showing now is the one which we would like you all to do, is what is.
We also do it.
No, what has been decided is you are from sponsored candidate
EH board, but Jacob left.
from Maharashtra, na?
No, myself from Malkangiri, Odisha.
From
This,
Odisha. You are one of the sponsored candidate, isn't it?
Yeah.
So, madam will be showing you 4, 5 topics. Out of that, any one topic you can choose. So, this can be one of the topics.
Ma'am, already we have selected the our topics, ma'am. I'm Yogoshmita, ma'am. I
And
have selected SWOT analysis for BMW management
you
in
are
our
also sponsored.
institution.
You are sponsored candidate.
Yes, ma'am.
Yes.
I'm sponsor candidate and from Odisha, ma'am.
Okay, that is very good. I think if you have chosen SWOT analysis, it is very good because that was also one of the topics. So I think after Madam presents, we will request you also to share, what work you have done for this project, so that others.
Till now, ma'am, not started yet.
Okay,
Actually,
okay,
we will start, ma'am. Actually,
okay, no problem. Then you listen to Madam how she is explaining, and if there is any doubt, you can ask her. And
okay, ma'am.
anybody else has selected? Others, have you selected any topics?
I will do the KVP study.
KAP study. All right, no problem. Anybody else has selected topics?
Impact of different training and awareness programs in healthcare waste management.
All right, that is also nice topic. Anybody else? Yes, you all of you must have selected some topics by now. Sriram, Mohanty, have you selected a topic?
Ma'am, namaste. Ma'am, situational analysis in BMW, ma'am.
What analysis?
Situational analysis, ma'am.
Situational analysis. All right, that is nice. You have done some work on it or only selected
No,
topic?
no, no, ma'am. Not yet started, ma'am.
Okay, what about Simi Lamba?
Ma'am, I started.
On what topic?
Ma'am,
We can't hear you. You have become mute. Can you unmute yourself? Yeah, Simi. No, unmute yourself. You put your camera on.
ma'am, I'm right now I'm studying the books only, ma'am, one by one.
Okay, okay. Okay. What about Pandit Sahu?
But I am not started the project.
Okay. So what I will suggest, I will request madam that she has already got a little bit of an idea what type of projects you are taking. She will explain to you how to go about the project, how to plan the project, how to execute the project, and then how to write the project report. So ma'am, you can tell them both things. First is planning and please mute yourself, Pandit. So you can just tell them how to plan for it, how to go about, the methodology for the different projects, and then how they will also conduct it, and then how they will write the report, ma'am. Little bit.
Okay.
Thank you.
Yeah, thank you. Okay, these are some of the other topics. Identify the disposal practices followed by the CTF in the district. Okay. So as I told you, you have to visit the CTF and find out from them, what are the disposal practices that is being followed there. Okay. So, and then based on that, you can propose based on that and the rules that are applicable, that is biomedical waste management rules, you'll have to propose appropriate strategies and guidelines to them. Okay. So, what
Yeah,
is the
just
methodology? Yes. So how do you select your sample? It could be the district hospital, the CHC, PHC. So this can be done by sampling. Okay. So can be 2 or 3 CTFs can be chosen based on the random selection method. Okay.
Ma'am,
So, huh?
ma'am, a question, ma'am. Should you write the proposal first, then after approval, we write the project, or we will go for the project directly?
No. You should write
no,
the
no,
project
no.
first. What you want to do, you
There
should
is no
write.
need for proposal. There is no need for proposal in this particular program. This is a very small project. In other programs of IGNO, you need to write a proposal. In this, there is no proposal. You just plan your project, discuss with your coordinators, discuss with your program in charge and counselors, and then start the project. No need for proposal. Okay,
Thank you, ma'am.
Okay. So
ma'am,
this is
please.
the, yeah. This is how you select your sample. That is which area you want to do it. Okay. Then data you can collect it by your site visit and by observing it. You have a checklist with you. You observe and you put down what is actually there in that checklist. Survey and interviews can also be done through. So you have to prepare a questionnaire if you want to do the survey and if you want to interview people. Okay. So these are the methodologies that you have to do. Then, if you're collecting data from the records, okay. So you collect the data. That is the secondary records. Okay. As I told you in the CTF, they'll be having their records which they're submitting to the pollution control board. So you can collect the data from there. Okay, annual reports also you can collect, and you find out what is the actual that they have to do and what is lacking in them. So that is how you do the comparison of the ideal situation and what is the situation in that particular CTF, and identify any local regulatory guidelines for the BMW disposal. Okay. Then any monitoring mechanism. Okay. Innovation and best practices can also be done. Okay. And the results based on the objective, you'll have to give your results. Okay. Objective should be clear. Okay. So you start off with the introduction, the objectives, the methodology. In the methodology, you will write which area you're doing, how many people you're doing, okay, how you're doing it. How you're doing it is all these. You can use any of these, okay. Then discussion. Discussion whether your study is similar to other studies or it is dissimilar. So your discussion will have all those. And then finally, the conclusion and recommendation. Okay, this is how your report will be presented. This is how you are going to submit your report. So this is another one for evaluating this segregation practices also. So you can do this way also. Okay.
Ma'am,
So
ma'am,
same.
I'll just interrupt here. So, ma'am, can you just show the topic again? Just the topic again.
Okay,
This
just
one, this topic.
I think this is a smaller this one.
So this is another one of the topics that has been selected for. This is another one of the topic which has been selected for the sponsored candidates. So those of you who are from Odisha, that this is a good topic. If you would like to take up this topic, then listen carefully how Madam is explaining what will be the objectives and how will you go about this study. Okay, so you can also consider this as one of your subjects. Ma'am, you go ahead.
Yeah. I think this is a repetition which I put across. Okay. 1 minute. I'll just check if there's anything else. So there are two project proposals. One is for disposal, the other is for segregation. Okay. Okay. Then finally, you submit your project report. How you prepare and submit your project report. It should be in that A4 size, typed in double space, bound report. Okay. And one of the typed copy should be submitted to the program in charge of the program study center. Okay. And on the top of the envelope, you should write project report, healthcare waste management. Students' copy, one copy will be kept with them. So the project report which are submitting it to the program study center will not be sent back to you. So better to have one copy with you. Okay. Okay. Now coming back to what you all are planning for, let us just discuss about it. Yes. One of you said you're going to do on segregation or disposal practices. Yes. Segregation or disposal practices.
Madam, myself planned for KABP study. Knowledge, attitude, practice.
KAP study, yes. I told you about the KAP study, no? So what you can do is you can do a pre-test and a post-test.
Yeah.
Okay, you can do a pre-test to find out what is the knowledge. So knowledge, attitude and practices, I said at least minimum 20 people should be there. And you should have minimum of, how many questions did I tell you? For
7 to
knowledge,
12.
7 to 14.
7 to 14.
Yes, 7 to 14. That means if you have 7 of knowledge, 7 of attitude, and 7 of practices.
What is the behavior?
Huh?
Behavior, ma'am?
That is not behavior is only attitude, knowledge, attitude, and practice. Okay, so each should have around 7 to 14 questions. So 7 is okay. 7 threes are 21 questions you'll have. Okay.
Yeah.
Okay. So you before you do the training, you do the give this questionnaire. Okay. Then do the training. After the training, do the post test. Then you can compare the pre and post. That is your results. Right?
Right, ma'am.
Okay.
Thank you.
Yeah.
Thank you, ma'am.
Yeah, thank you. Anyone else? You all had suggested some topics, no? Just let us go back to those topics.
Ma'am,
Ah,
in my topic also impact of different training. Whatever you say, like pre-test, pre-test and post-test.
yeah. You are going to train them on what? Who are the group of people you're going to train?
Different category people like West handlers as well as nursing officers who
Okay.
can,
So in
as
this
well as
case,
doctors.
yeah, in this case, what happens, doctor's level of thing will be different from a waste handler. So
Yeah.
you'll have to prepare the questions in such a way that for waste handlers, it is very simple. We need not have to speak elaborately about all the various segregation and all those things. Okay, you'll have to tell them about only what is a PP. Like yesterday, I showed all this, day for yesterday, I think I showed the
Yeah.
flip chart,
Yeah.
Okay, so that way you can which is the category of healthcare workers you'll have to see, and based on that you'll have to frame your questions. Okay.
Okay, ma'am. Thank you.
You are speaking, you are mute. Please unmute yourself. We can't hear you.
Who is that speaking, madam, now?
Yeah, she is speaking about her. You're speaking ना? हॉस्पिटल मैनेजर करके ज्वाइन किया है आपने? I think you are speaking. She is trying to unmute. Okay, no problem. Somebody else can speak. See, this is the opportunity to discuss your projects today. Okay, tomorrow it will be difficult for you to find a good counselor to discuss. Please discuss your topics, how you will go about whatever problems you are facing. Please discuss today. Okay.
Hello, ma'am.
Yes,
Yeah.
yes. Shreya.
Ma'am, this project submission is only for sponsored students or any other else?
Yes, this is only for no, this is for all those who have opted for project as an elective because it is an elective topic now. So all
Okay, ma'am.
sponsored
Okay.
students have had were required to take a project. आपने कौन से elective opt किए हैं?
मैम आई थिंक मैंने प्रोजेक्ट नहीं किया है.
नहीं किया है तो doesn't matter.
नो
आपका बस
मैम.
knowledge gain हो गया है और कुछ नहीं हुआ है.
ओके मैम. ओके.
Why not? You can do a project, no?
No, ma'am, I am
Yeah.
working in infection control section. That's why I opted for this certificate
Infection
course.
control.
Okay.
Yeah, you're in the infection
Yes,
control.
ma'am.
So what? You are in the hospital infection control committee, no?
Yes, ma'am. I am in the hospital control committee
Yeah, you
working
can
as an
do a
infection
study.
control nurse.
Yeah, you can do a study and you can publish it. You can go to any conference with regards to infection control or the hospital. I don't know. There are certain conferences where you can attend and present your paper, no? Priya?
Yes, ma'am. Yes. Yes, ma'am. Yes. For sure. Thank you, ma'am.
Thank you.
What else? Anybody else wants to ask about their topic, please?
Madam,
Yes.
myself, Dr. Mirza from Odisha, ma'am. I
Mhm.
want to do the project on comparative studies of waste management in two CSCs.
Okay. So since it's a comparative study, the same questionnaire should be used for both the places. Okay.
Yes.
So what are you looking at the waste management systems in these two CHCs? Is it that?
Yeah.
Is it that, Dr. Mirza? You're looking at
Yeah,
the
ma'am.
waste management. Yes. So as I already told you, you will have to look into how many wards are there. Okay. What is the infection control practices there? So whatever you're doing in one CHC, the same thing should be done in the other CHC so that you can compare and contrast. You can find out what are the best practices in one of the hospitals, what are the practices that can be followed in the other hospital also. Okay, so that could be your recommendations.
No, ma'am. I want to know whether only one thing can be done on or in total. Only segregation practice may be there, or only infection control practices may be there, or
You
in
can
total it
decide
will be.
you can decide based on the time available for you. You can do it in total for both but whatever you do, both the hospitals, it should be similar is what I'm saying. If you're looking only at segregation, you look for segregation only in both the hospitals. Okay. And there may be certain things which are good in one hospital. So you pick up that and you tell that this is what I recommend for the other hospital. Right? That's what you can do. Or you can look at the entire waste management system. Since you have
Okay.
opted for that, you can even think of the entire waste management system, the records that they keep for the waste management systems, whether they have an injury. And this is all part of the biomedical waste management rules. So you can look into the rules and see whether the rules, they are following all the rules as applicable. 2016 biomedical waste management rules. So you can prepare a format and look into all these rules, whether it is they are following it or not.
Okay, ma'am.
Yeah.
Madam, someone has taken. Can we take whatever topics has been already discussed regarding like segregation practices only in hospital, one hospital? I am thinking of taking the comparative one, but only segregation practices can be taken in hospital also.
Yeah,
You
you can
want
do that also. So you can give some scoring system also. If there's mix of waste, you put a score like that. The infectious waste, like if all the waste is put into one container only, what will you score. You make a scoring system for that. Okay, based on the scoring you can then decide to put your results. Okay, it's, you cannot tell, see, this waste was mixed with that waste in the results. You will have to, it is more realistic if you put it in the form of a scoring system. It becomes more presentable. Okay.
Ma'am, that will involve also training, subsequent training accordingly, and post
Yeah, you
evaluation.
have to. Once you have done that, it is your responsibility to train those people to say that by mixing this waste, the infectious waste, the different infectious waste, who is at risk? Who is at risk? Okay. And what is the problems associated with it? You'll have to train them. See, the attitude of the people has to change, isn't it? That's the main thing that is happening in the healthcare waste management systems. It is more than anything else. It is not hard work. It is only the attitude. So the attitude of the person should change. There's
So
nothing.
here I would here ma'am, I would also like to add that basically I would like to add that over here it will be very nice if you can have, this will be a basically interventional project in which you are taking basic data and trying to find out what is the difference, what is the baseline, where they stand, and then you give them education and then also evaluate. It will be quite a big project,
Yeah,
but if you
but
want to
within
take
one
it, it
month.
will be very nice.
Yeah, but within 1 month, I don't think it is
It is
possible.
not possible, but it is not possible,
Isn't
but
it?
what you can do is, for the program you can submit part of the project and then you can continue that project, because it will be in the interest of your district. You will
Yeah,
you will bring out some very important findings on which the policy decisions can be taken on. So the main purpose of our having a project as a compulsory component of all the districts in Orissa was so that the districts can find where are the strengths, where are the weaknesses in the particular district as far as biomedical waste management is concerned. And through your projects you will yourself come to know what is weakness, what is strength, and that weakness how you are going to strengthen. So it will depend entirely on your initiative, your motivation, and your work that you will do, which will help the district to become better. So take a small component as part of this program and carry on later on, for a larger component. It is very good that you have brought out this question.
yeah.
Thank
Is
you,
there
ma'am.
a CTF now in Odisha? Dr. Mirza, is there a CTF now?
Yeah. In Odisha, there is CTF is there,
Yeah.
but in my place, it is not there.
Mm-hmm.
Chandrapara. I am district headquarter hospital, Chandrapara.
Mm-hmm. Yeah.
जो
Yes. Nivedita. Huh?
हम लोगों का जो प्रोजेक्ट हम लिखेंगे वो तो अपना जो रीजनल सेंटर है ना वहाँ पर ही पहुँचाना है।
हाँ,
Ah,
ऑल योर
yeah.
प्रोजेक्ट, हाँ, ऑल प्रोजेक्ट्स विल पहुंचाना है, रीजनल सेंटर में ही पहुंचाना है।
हाँ मैम, अभी आज जो 19 आज प्रोजेक्ट लिखना है।
सुनाई नहीं दिया, क्या बोला आपने?
मंथ ड्यूरेशन चाहिए, तो आज तो 19 हो गया, नेक्स्ट 19 के आगे हम लोगों का प्रोजेक्ट लिखना है।
देखो, कोई टेंशन नहीं है लास्ट डेट प्रोजेक्ट का, ठीक है। जब भी आप प्रोजेक्ट दोगे उसके बाद आपका ग्रेड कार्ड बनेगा, आपको डिग्री मिलेगा। आप जल्दी दोगे आपका ग्रेड कार्ड जल्दी बन जाएगा, आप देर से, तो आप जब भी आपने ज्वाइन किया है उसके 2 साल के अंदर आपको प्रोग्राम खत्म करना है, ठीक है, 2 साल के अंदर। तो आप पहले 6 महीने में कर लो, आप 1 साल में कर लो, आप 1.5 साल लगा लो, आपकी मर्जी है, ठीक है ना। लेकिन आप जितना जल्दी करोगे उतना जल्दी आपको सर्टिफिकेट मिलेगा इग्नो से। ओके
मैम, एक्चुअली मेरा जो एग्जामिनेशन हुआ था उसका तो स्कोर आ गया है, वो BHM-1 और BHM-2 का। तो ये प्रोजेक्ट वर्क देने के बाद ही फाइनल रिजल्ट और फाइनल सर्टिफिकेट मिलेगा क्या मैम?
हाँ हाँ, बिल्कुल बिल्कुल, क्योंकि ये भी एक कंपोनेंट है ना, इसलिए।
मैम, पोस्ट ऑफ का लॉगबुक देना है क्या मैम?
पोस्ट वर्कशॉप का लॉगबुक भी देना है, वो आपको मौलाना आजाद के एड्रेस पे भेजना है।
ओके मैम, थैंक यू मैम।
मैम मुझे और एक बात पूछना था, हम लोगों का जो वर्कशॉप
आप लोग तो जुलाई बैच के स्टूडेंट्स हो, आपका स्कोर कैसे आ जाएगा अभी?
नहीं सर, ये जुलाई बैच के स्टूडेंट्स नहीं है। आज के पर्टिकुलर क्लास के लिए हमने सारे पुराने 2 साल तक के स्टूडेंट्स को बुलाया है। हाँ जी, निवेदिता।
हाँ मैम, जो मेरा वर्कशॉप का जो कॉपी आया था ना,
हाँ
3 कॉपी आया,
हाँ,
उसको भी फिलअप के आप लोगों के वहां पर भेजना है, दिल्ली में भेजना है क्या?
सिर्फ सिर्फ उसको फिलअप नहीं करना है, उसमें लिखा हुआ जो काम है वो भी करना है। करोगे फिर फिलअप होगा, फिर भेजोगे, ठीक है। और
वो
वर्कशॉप वाला फाइल तो तब फिलअप होगा जब आप फेस टू फेस वर्कशॉप करोगे, ऑनलाइन वर्कशॉप करोगे, ठीक है। अभी जब वर्कशॉप प्लान होगा, अगर आपने नहीं किया है तो प्लीज वर्कशॉप में पार्टिसिपेट करिए, ठीक है।
ठीक है मैम।
यस मैम, प्लीज।
मैम व्हाट्सएप का टाइम
Madam,
कब है? हेलो मैम,
Yes, Krishna.
व्हाट्सएप का टाइम ऑफ व्हाट्सएप टू रुचिका
हाँ
मैम।
हाँ, टाइम ऑफ वर्कशॉप विल बी प्लान्ड एंड कम्युनिकेटेड।
थैंक यू।
Yes, Krish, who is next? Anshika, you have raised your hand.
ma'am, workshop.
हाँ हाँ, tell me. हाँ, Venga Des Prabhu, please tell.
Ma'am, yes, ma'am. Workshop is an online or we need to be
Workshop will be
present in
online.
person to attend the
Workshop will be
workshop.
online. It will be online.
Okay,
Is it
ma'am.
optional?
The logbook which we have received, those has to be completed and sent to that
You have
regional
to
center, ma'am.
you have to do the activities on the pre-workshop logbook, complete those activities
Okay.
and send the logbook, and thereafter about a month later your workshop will be planned where you will complete your workshop logbook. After your workshop you will complete your post workshop logbook. Okay. So
Okay.
let us now concentrate first on the projects which madam is here to discuss. Then after she leaves, we can talk about the workshop. Okay.
Yes. Okay.
Excuse me, ma'am.
Hmm.
Hello.
Anshika, yeah, Anshika.
Good evening, ma'am.
Good evening.
मैम एक्चुअली मुझे ये पूछना था कि वर्कशॉप हमने जब फॉर्म फिल किया था ये कोर्स के लिए, तो जब हम वर्कशॉप के लिए कर नहीं पाए तो हमें अब करना के लिए क्या करना पड़ेगा वर्कशॉप के लिए, अगर हम ज्वाइन करना चाहते हैं?
वर्कशॉप की बात बेटा बाद में कर लेंगे। मैडम यहाँ प्रोजेक्ट डिस्कस करने आई हैं। आपके लिए एक और वर्कशॉप प्लान जब होगा तो आपको मैसेज मिलेगा व्हाट्सएप ग्रुप में, ठीक है। अभी मैम को प्रोजेक्ट डिस्कस करने दो, ठीक है।
ओके मैम, थैंक यू मैम।
अभी अपने सब प्रॉब्लम्स प्रोजेक्ट रिलेटेड पूछ लीजिए प्लीज, व्हाट एवर प्रॉब्लम यू हैव, ताकि आप प्रोजेक्ट कर सके, नहीं तो प्रोग्राम कंप्लीट नहीं कर पाएंगे।
मैम लॉगबुक अभी आया नहीं है हमारा।
वो सब लॉगबुक अवेलेबल है, आ जाना चाहिए। आप एक मेरे को मेल कर देना, ईमेल करना, ठीक है, सारे डिटेल्स।
ठीक है। और सर मैम कुछ बुक्स भी नहीं आई है, मतलब
आप
कुछ
सारा
बुक्स
कुछ
भी रह
ईमेल
गई।
कर देना। ओके, यू ईमेल दिस प्रॉब्लम टू मी। ओके। ठीक है, और किसी को कोई क्वेश्चन नहीं पूछना है? कैन बी क्लोज द सेशन देन? कोई और क्वेश्चन नहीं है? हाँ कृष्णा।
मैम व्हाट्सएप इज ऑप्शनल और कंपलसरी फॉर ऑल?
Workshop is optional elective, but if you are a sponsored candidate, it is compulsory for you. Otherwise, if you have taken the elective, then it is compulsory. Okay. So if there is no question on the project, I think we can relieve madam and thank her very much for giving very nice overview. And I will request ma'am to also, if there are any queries, we will email you ma'am, so that they can get their email,
Discuss
their
with me.
project
Yes.
sorted out, whatever their queries they may be having. Thank you very much ma'am for taking out time and
Yeah.
explaining the project so nicely.
Madam, the last question, madam. This is regarding the PPTs to be sent. I had sent day first, it bounced back the email ID which was given. Sir?
Yeah.
Email ID which was given, it bounced back 2 days back when I had taken the class. I sent it.
Which mail ID, ma'am? Classroom.
RC Bhuvaneshwar.
Yeah.
It bounced back.
Comes back.
Hmm.
So PPT.
Yeah, my PPTs.
There's a grab but raise the hand.
So I mean, student wants PPT or what, ma'am?
The students want the PPTs, no?
So you send it. I mean, RCPPS classroom to @ignorant.ac.in. This is our email ID. You send it to me. I will send it to the students.
Okay, so please send me a mail of your email ID. I will send it.
Already you had sent the invitation to you, ma'am.
Yeah, in that only the mail is not going,
That mail, that is the only mail ID, ma'am.
because it bounced back, I told you. So just tell me again your.
Again, you send it to me. I will send it to students.
Okay. Huh?
Okay.
Okay.
CA4 with a Jacob says it.
Thank you, sir.
Thank you.
You were there, left there, outside it, and right there, join.
Ma'am?
So we need Randy, but left the meeting.
Ma'am?
Sir, please share the PPT for the previous classes also, sir.
Yeah, I will send it the PPT. Once the mail will send it the
Because
PPT to
we
me.
haven't received any PPT till now. So can we, from this batch, we can request you to send the PPT, sir?
Yeah.
So he was having left there, outside
Sir,
it.
need to ask you one question,
Sir,
sir.
can you please stop the recording, sir, first? Can you stop the recording because the session is over now?
Ma'am, Ruchika ma'am?
Yes, tell me.
मैम एक्चुअली वो पोस्ट लॉगबुक का मैम सारे एक्टिविटी करना है ईच सेशन में
नहीं, हर सेशन में एक एक्टिविटी करना है, हर
यस
सेशन
मैम
का
यस
एक
मैम
एक्टिविटी.
हाँ मैम थैंक यू सो मच मैम